everyone, I am Cherry Ann Ayan and I will be discussing one of the elements of digital citizenship, and it's all about digital health. So what is digital health? According to IAWA et al. 2016, digital health defined as an improvement in the way healthcare provision is delivered by healthcare providers through the use of information and communication technologies to monitor and improve the well-being and the health of patients, and to empower patients in the management of their health and that of their families. And there are categories of digital health. The first category is mobile health. Mobile health technology is the use of smartphones, tablets, and other mobile devices to deliver healthcare and preventive health services. Here are some apps example of mobile health like Fitbit, Apple Heart Study, Google Fit, Samsung Health, Allied Course Cardia Mobile, and Blue Star. The second category is health information technology. Enables health practitioners to store and retrieve data relating to patients' health records. It also enhances the communication of patient information through a legible format that anyone can use. Instead of writing information about doctor's visits and treatments in a paper records, all information is managed electronically. Here are some examples of app of health information technology like HERDIN or Health Research and Development Information Network. The third category is wearable devices. These are products controlled by electronic components and software that can be incorporated into clothing or worn on the body like accessories. Here are some examples of wearable devices like wearable health watches, fitness tracker, wearable blood pressure monitor, continuous glucose meter, wearable electrocardiogram monitor, and wearable biosensor. The fourth category are the telehealth and telemedicine. Healthcare provider for you without an in-person or office visit. It is done primarily online with internet access on your computer, tablet, or smartphones. Here are some apps example of telehealth and telemedicine like MD Live, Lemonade, Live Health, PlushCare, Amwell, Doctor on Demand, Talkspace, Teladoc, BCBSM Online, and Spros. The fifth category is the personalized medicine, also known as precision medicine. It is a new frontier of healthcare combining genomics, big data analytics, and population health. Also an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person. Example of mobile app that for precision or personalized medicine are Medisafe, Dexcom Continuous Glucose Monitor, Cardia, Cara, and RipUp. Many of us use technology for our benefit, and with the proper use of technology, it can give us advantages such as health apps to track chronic illnesses and communicate vital information to doctors, health apps that help you track diet, exercise, and mental health information, online medical records that give you access to test results and allow you to fill prescriptions, virtual doctor visits, enhanced communication with others, which can improve the feeling of connection, greater patient care, and improve access to information. Also, overusing of technology can give disadvantages, and the first disadvantages is eye strain. According to American Optometric Association, prolonged use of computers, tablets, and cell phones can lead to digital eye strain, and it may include blurred vision, dry eyes, headaches, neck, and shoulder pain. And the possible solution for this are look away frequent, or every 20 minutes, look at something 20 feet away for all at least 20 seconds. Position your screen or hold your screen at least 18 to 24 inches from your face. Find the right light, multitask correctly, use eye drops, check the air, wear proper eyewear, and reduce time spent on a single activity. Second disadvantages is sleep problem. Using technology too close to bedtime may cause issues with sleep. This effect has to do with the fact that blue light such as the light from cell phones, e-readers, and computers stimulates the brain. And the possible solution for this are: go screen-free for 30 to 60 minutes, make your bedroom a sleep sanctuary, and don't bring your phone or tablet to bed. The third disadvantages is poor posture. Using of mobile devices on computers may also contribute to incorrect posture. Over time, this may lead to musculoskeletal issues. And the possible thing that we can do to avoid these issues are: in using mobile phones, hold your devices at eye level right in front of you. Use a phone or tablet holder. Stand or sit upright, don't slouch or slump. Find a place to rest your elbow. Use phone voice dictation instead of texting, and give yourself a break. And also, when using computers, we should sit upright and look straight ahead. Eyes should point directly at the top third of the computer screen. Forearms should be parallel with the floor when typing. Elbows should be at the side. Feet should be flat on the floor with the thighs parallel with the floor. And take intermittent breaks. The fourth disadvantages is mental health. Social media addiction is linked to a rise in mental health disorders like depressions, suicidal ideation, particularly in teenagers. And the possible solution for this are: spend less time on social media platforms. Make social connections, especially face-to-face, a priority. Stay active, talk to someone, appeal to your senses, take up relaxation practices, make leisure and contemplation a priority. Don't skimp on sleep, get help if you need. Know when it's time to stop scrolling on social media, and use social media to connect with people who inspires you, share similar interests, and provide a sense of belonging. The fifth disadvantages is social isolation and loneliness. Social isolation is increasing due to personal computer technology like smartphones and laptops. Both teens and youngsters spend more time on social media, internet surfing, playing games, and ignoring their real lives. And the possible solution for this are: connect with family and friends, getting out of the house and being active, or find new activities to join. Get some support if you need. Do the things you enjoy and stop your negative cycles. Sixth disadvantages is depression and anxiety. Using of social media more often, though, increases fear of missing out or the FOMO, the feelings of inadequacy, dissatisfaction, and isolation. In turn, these feelings negatively affect your mood and worsen symptoms of depression, anxiety, and stress. And the possible solution for these are: engaging in face-to-face social interaction trends, go for activities that involve other people such as attending religious service or engaging in sports, and stop your negative thought cycles. This technology, not only into teens and adults, has a disadvantages, but also in children, overusing of technology has a disadvantages too, because children's brain are still developing and may be more sensitive to the effect of technology. Children who overuse technology more likely experience issues including behavioral problem, less time for play and loss of social skills, obesity, sleep problems, and violence. And the possible solution for this are: monitor and limit children's social media use. encourage exercise and offline interests or outdoor activities. Engage them in housework specific to their age. Here are the recommendations of American Academy of Pediatrics for screen time by ages. Age 2 and under, avoid media use except for video calls. Age 2 to 5 years old, limit screen use to 1 hour or less. Age 6 to 12 years old, limit screen use to a healthy amount, no more than 2 hours of use. Teens, limits should be set up. Parents should make sure their teens are physically active and do other activities offline, especially social activities. And for adults, less than 2 hours of screen time for recreation. And in addition, there are also negative effects of using or wearing headphones for long periods, such as ear infection, ear pains, dizziness, hearing loss, and lack of focus. Possible solutions or possible way that we can do to avoid these side effects are: avoid high volume levels, take listening breaks, do not sleep wearing headphones or earbuds, avoid sharing earphones to anyone, and use headphone for 60 minutes a day. Also, there are negative effects of using or playing on cell phones while it is plugged in. These are the risk of electrical overload, overheating risk, risk of electrical shock, radiation risk, and short circuit risk. There are lists of important tips to avoid the dangers of playing on a cell phone plugged in that can save your device and even lives. Let's check it out. First is, do not use headphones while charging the device. Second, when going to sleep, keep the device away from flammable objects and out of reach of your body. Third, don't muffle your cell phone. Don't let the device charger under your pillow or your body. Fourth, avoid charging the devices in damp areas such as bathroom or laundry areas. Fifth, disconnect the headset from the charger before answering a phone call. Sixth, use charger certified by Anatel and check if they have quality seats. And don't leave the charger in the socket after you finish charging your cell phones. And also, the negative effect of sleeping next to your cell phones are: sleep is disturbed, increases brain activities, might cause cancer, cognitive and behavioral problem, reproductive malfunctions, and bed on fire. Possible solutions or possible way that we can do to avoid these side effects are: keep your cell phone at least 3 feet away and try turning off notifications. Here are some takeaways. Technology is a part of our lives. It can have some negative effects, but it can also offer many positive benefits and play an important role in education, health, and general welfare. Knowing the possible negative effects can help you take steps to identify and minimize them so that you can still enjoy the positive aspects of technology. That's the end of my discussion on digital health. I hope you learned something new today. If you want to get a copy of my presentation, please see the link below in the description. Thank you and God bless.